So I'll just quickly give my introduction right before starting the webinar so that you people can understand and know a little bit about us, right? And that is when it will be good that we will, converse more when we start this challenge, right? So basically, my name is Yogesh Prajapati, and I think I have mentioned that I have been working in the IT industry for almost a decade now. Currently, we are based in Bangalore, and I have been into fitness for almost 15 years now. And fortunately, got to know about this community, which is the name is Wellness Quotient, a couple of years back, and that's when I thought that maybe let me also learn a couple of things from this community, as they already had a great presence in across more than 60 plus countries, and I'm a person who was more into fitness, right? So this transition was very important because I still know a lot of people who are just focused on who are focusing on just specific pillars of wellness. But it is very important that we also think and know more about all the pillars. For example, stress management, sleep management, more about nutrition. More about bringing mindfulness, right? And that is where I transitioned, and I have been helping a lot of people, right, with different kind of lifestyle issues, and I'm grateful that I'm able to add value in their life. uh, Being into IT, I think the very first question that might come in your mind is that, how come I IT person can talk about inflammation or maybe some different kind of issues like diabetes, thyroid, PCOS, or maybe fatty liver, right? But I just want to say that all of these issues, right, these are formed in body because of the lifestyle. So we do not really need a lot of medical intervention when it comes to, let's say, reversing a fatty liver, or let's say reversing diabetes, because we know that we just have to work on certain pillars of wellness consistently with good knowledge and guidance, right? But yes, when it comes to, let's say, maybe doing a surgery, or maybe going through a complex process, I'll highly recommend that we seek a best available medical advice, right? So these are two different streams, and but we believe that for us it is easier to know more about body. For us it is very easy to understand more about health and wellness. I can't really go and learn a lot of medical practices. That's not my job. People are doing it. So what we can do, we can change the way we live our life every day, right? So we have been running these kind of awareness programs for a very long time now, and that is why I'm very confident that 3 days are obviously not enough to reverse certain things, but it will give a great kick start. People have seen tremendous benefit in terms of their psoriasis condition, their bloating, acidity, headaches, cravings, mood swings, right? You name it. Okay. So I'll just briefly, I'll just share my screen so that we can go through the very first agenda, that all about inflammation. And I tried my best to keep things pretty simple so that everyone can understand these things. And I have not used technical jargons, because we don't want to do it. We want to keep it simple because I know that most of us are not from the medical background, right? So okay, I hope you all can see my screen, and then I can move ahead, right? Perfect. Can someone write in the chat if possible that they are able to see this?
Yes,
Okay.
yes.
Okay. Thanks, Himal. Thank you so much. Okay, perfect. So, see, most of the health problems, right, which are diagnosed these days, whether it's, as I mentioned earlier, that whether it's arthritis or maybe hormonal imbalance, PCOD, thyroid, right, heart problems, very common these days. And in fact, people who are in an age bracket of 20 to 30 are getting a lot of heart, issues. So, these problems are not something which are diagnosed, in a very short span of time. Let's say someone who is at 45 years of age, and someday they will see HbA1c just shooted up to 6.5, right? Maybe CRP was more than 2 or 3, or maybe it came as 10, right? The thing is that these kind of problems are not diagnosed in a very short span of time. It takes time, right? Body develops time. So that is what I have mentioned, that it is a very slow process. Right. We don't know what's really happening inside the body. But if we are not following a good lifestyle, or in fact, if we are not trying to follow a good lifestyle, things will build up inside the body. And I can share from my experience that a lot of times these problems won't even come in the report, right? For example, let's say if your HbA1c is 5.8, which is pre-diabetics. So people usually take it very lightly, right? They say, okay, it's pre-diabetics, border range, right? But they don't know that it has been developing inside the body for last couple of years, right? It's not just the average of 3 months. Okay, 3 months HbA1c, the average reading was 5.7. So probably I'll, reverse it back in next 3 months. No, it has been developing in the body. So until and unless we go back, find out the root cause, fix what we are not doing good, then only we can move ahead and reverse our health condition, right? So it's a very slow process. And that is why it becomes very important for us to work every day. And that is when we can, kind of heal the body internally, right? Anyways, when it comes to inflammation, a lot of people are in fear with this word because that's how it has been portrayed over the social media, right? But I think it's very important, and I believe that most of us might be knowing that it is something which is our body's response and which is very, very vital, right? Maybe, if you fell down, then there will be, the redness around that area. Or maybe if you are getting some sort of fever, or maybe you're getting some kind of headaches, these all are inflammatory response from our body, which is very, very important. And that is how our body actually works in a very beautiful way. If you give enough time to our body, it will heal. But along with that, the environment has to be there, right? If you body, probably takes, let's say, 7 days to fix that redness, but that's good because that's how our body works, right? So those are acute inflammation, very important for us. But when there is some sort of problems going on in our life for a longer period of time, that is when it creates a problem, because immune system will trigger again and again. And that is how it will develop a lot of plague and a lot of toxicity in the body. So if you see this diagram, this is basically a simple artery, but because of the lifestyle, because of our inflammation which has been there for past couple of months, years, right? It will start developing plaque, and that is how it will block the arteries. So when there is not enough supply of oxygen, of nutrition in the body, it will reflect in all the other systems of the body, right? So that is why we have to be very mindful that whatever we are going through, it should not be chronic. We have to immediately take some steps to reduce this down. It can be stress, it can be, maybe sedentary lifestyle. We cannot do it, we cannot sustain it for a longer period of time, because eventually it will convert into a chronic inflammation. And then reversing the chronic inflammation will be a tough job, right? So don't fear this word inflammation. Just be aware that what kind of inflammation you have in your body and how we can slowly reverse it out. When it comes to some of the very important trigger points, I personally believe that at least in today's era, it's not food, because a lot of people are aware right now that what to take, what not to take. If in fact, if I ask you that, are you taking a lot of junk these days? I'm sure that 90% of the people or more will definitely say that it has been reduced a lot and they have been trying to eat healthy, because they know that it is very important, to not take this kind of food uh, very often, right? So I think that trigger point is little less on priority. Uh, but what's there on priority? I think stress and central obesity. Stress, one of the very, very important, a kind of root cause for developing the inflammation in the body. People who are lean, they are diabetic, it's because of the inflammation. Women are having thyroid issues or stress, maybe it's become some sort of problems going in their life. It might be related to in-laws, it might be related to their own spouse. A lot of women with whom I'm working currently in US, they are having a lot of problem with their teenage girls, because there is a shift, right? They are Indian, obviously. We all are Indian, but there has been shift in the demographic, the area. So it's giving a lot of stress to women. That's what I understand. So we have been obviously helping them that how we can tackle this problem. Central obesity, I truly believe, and if you go back and search it today itself, 3 days back, we got a news that BMI is a very risky parameter to track your health. And I have been saying this for many, many years now because it does not give a right indicator of your health. Even if your BMI is 30, and if you're doing fine in terms of maybe stress, in terms of your physical activities, if your reports are clean, it's perfectly all right. But if you have central obesity, right, if there is fat, that fat can definitely impact a lot of things, including the hormone, including your organs, because this will develop visceral fat in your body, right? Organs will have some more layers of fat around them. And imagine if something is having more amount of fat or maybe blockers, it will not be able to communicate well. It will not be able to function very, very well, right? So central obesity is one of the very important thing. Alcohol smoking, again, a lifestyle, but again, I truly believe that this is very occasional for people these days. Someone who is taking it every day or maybe thrice in a week, they are having some again different problems in their life. So we don't want to go into it. But toxicity again is again one of the very important, pillar right now. Consumption of plastics or consumption of chemicals or consumption of low grade cookwares in their kitchen, consumption of aluminium, right? Alcohol, again, smoking, pollution, a lot of things will play their role. But yes, this is also one of the very important reason, because I'm saying this because one of our person who is right now a coach with the community, he's in fact working in a coal plant in India, and because of those environment and the toxicity and the air, the pollution, he was diagnosed with thyroid, right? So these all are practical things, and that is why I have mentioned it here. Now, when it comes to maybe identifying that, how can I identify that where is the problem? I have been trying a lot to lose weight, but I'm not able to do it. Maybe we have to understand that it's not always about the calorie deficit. You cannot just reduce your food intake. It matters a lot, but you have to make sure that it's nutritious, right? Less is okay, but it has to be nutritious. So calorie deficit is equally important, but if there is this glitch in the cellular communication, right, which means that your cell itself is not able to communicate well with all the other cells of the body, obviously there will be imbalance, right? How it happens, I'll try to talk about it quickly. But if you are taking some sort of medications, or maybe if you are seeing some sort of swelling in your face, maybe especially early morning, and if you're having, let's say, hair fall or period cramps or skin issues, these are the very top important root causes and symptoms which can help you in identifying that what can be the problem if you're trying your best to lose weight and it is not happening, right? Uh, Second one, right? If you're feeling tired a lot, maybe by the end of the evening, if you're feeling fatigue, or early morning also, if you're feeling a lot of fatigue, then in that case also it's because of the mitochondrial damage. We all have, gone through science lectures in our school, known about mitochondria and cell. I was not really sure that we will again come back to this word, especially at the age of 32, right? Or 30 maybe, right? But that is a damage which is happening inside the body. So if you are feeling low on energy, low on strength, if you are feeling burnt out, right? If you feel that you are getting older as compared to your age, and then you are also observing some shortness of breath, in that case, it signifies that there is a mitochondrial damage, which means the ability of mitochondria to produce the energy is, it's not very efficient right now. And there are obviously solutions that how we can increase the mitochondrial activity in the body, right? You can easily go out and research about it, but that is the scientific way of knowing things. So everything has their own reason. That's why I just thought that I'll cover some important symptoms of the body. Brain fog, again, one of the core reason is oxidative stress, which means probably you are having a lot of stress in your life because of different reasons. It might be career, it might be relationship, as I said, it might be your own health, right? So these are the very important categories in which you might feel stressed about it, managing too many things, then kids, then office, uh, lot of things, right? So, but it comes to when it comes to the symptoms, I think confusion, poor concentration, forgetting things. So when I talk about forgetting things, it's not Alzheimer, right? Don't take it in other way. It simply means that you know that thing, but somehow it's not coming, right? You know it. It's there, but it's not coming out. So you will feel that why I'm not able to recall certain things very quickly. I used to be pretty efficient earlier. I have been working with a lot of people, and they say that my concentration has been impacting a lot these days. I'm not able to focus a lot. Probably, if you are in IT, maybe if you will say that if I used to take, let's say, a couple of minutes to write a query or write a code, it's taking a lot of time for me these days to, run the same amount of code and queries, right? You might also experience a loss of sense of taste and smell. So if you feel that, yeah, this is something which is maybe relatable, then the problem is that there is a lot of oxidative stress. And as I said, that oxidative stress means your cell is also going through some sort of stress in the body, right? So ultimately, whenever we talk about any of the health problem or condition or symptom, you drill it down to the cellular level, because that is the smallest unit in our body, right? If you are having, maybe let's say, cravings, right, it is not your problem. It is the cell which is craving, which is getting a lot of a craving for different kind of food. If you are gaining weight, it is the cell that is changing, right? You are not accumulating some sort of air in the body. It is the cell that's getting changed, right? That is also one of the very important root cause. And when it comes to another symptom, very vital, I think, digestive health, a lot of people are facing it. In fact, I did a webinar for a university couple of weeks back, and it was purely on this, you know how to work on the digestive health, what is causing the problem. So the problem is assimilation and elimination, which means your body, because of certain reasons, is not able to break down certain things in the body. It can be protein, it can be carbohydrate also, it can be fiber also, but whatever you are giving to your body, it's not able to digest, it's not able to break it well. So that is assimilation. Let's say if it is able to kind of break it well, but probably elimination is not happening. So that is also one of the core reason that people get a lot of gastric issues and bloating and so many other things, right? uh, just a minute, I'll just mute someone. Okay. So mouth ulcers, having dandruff, maybe having stomach pain, mood swings, highly related to digestive health. If you are allergic to any of the food, if you are diagnosed with kidney stones, not today, maybe a couple of years back, having a bad breath, all of these, kind of symptoms shows that there is a problem with the assimilation and elimination. And since it's gut health, 70% of the immune system is there. It will get triggered a lot again and again. That will give rise to different kind of problems. So gut health is an entry point, and we have to be very serious about it. Uh, Okay, after that, again, one of the very important marker for the inflammation in the body is joint pain. Again, people, especially men, might face some kind of shoulder pain at the back, right? But yes, back pain, mobility issues, joint pain, shoulder pain. These all are the symptoms which also says that your structural behavior is changing in the body, right? As I mentioned earlier, also that drill it down to the cellular level. So the structure of the cell is getting changed. How? Again, lifestyle changes and those, couple of important root causes which we discussed earlier. So that is why it is important to have some awareness about it, right? And that's where the, let's say, the 3 days of programs comes into play. But if we know, right, that maybe we are having some sort of concerns in the body, right? If not the report, but I'm having, let's say, morning giddiness, why I'm having bloating in every 2 or 3 days, my sleep is not really good these days, why I'm getting somehow the back pain, right? Everything is looks report, good in the report, right? So what I'll recommend, that if you have not gone through a full body blood work, that should be the very first thing which we should do, and we have to do it every year. And if you are having some kind of, let's say, condition, then every 6 months also you can go through a blood work. Now, the problem with the blood work is that if you opt for a regular blood work, it will just consider CBC, maybe thyroid profile, maybe HbA1c. But there are other lot of important biomarkers which help us in understanding your inflammation in the body. Those could be CRP, those could be homocysteine. Uh, Apart from that, it can be ESR for sure, your lipid profile, uh, thyroid profile, obviously, HbA1c, right? Those are very, very important. LFT, KFT, everything should be there. So, including the vitamin deficiencies, don't take it lightly. I mean, some deficiencies can cause a lot of problems because drill it down to the cellular level, think that this cell is not getting vitamin B12, how it can work efficiently, right? So, full blood work is important. Do it every year. Consider it for your family also, because they might not have that awareness, right? Second, symptoms. As a wellness practitioner, I focus a lot on this, category symptoms, because it basically tells us that how we are leading our life every day. If your day is going good, you mean you are doing good. But if you are facing some sort of symptom, maybe not every day, but in every 2 or 3 days, you have to be aware of it. You should not say that I don't know why am I, I'm getting a elbow pain maybe, right? I don't know why I'm having hair fall. There has to be reason. Try to find it out. Don't just neglect it saying that I don't know. Some maybe food, maybe no. That's not the right language. Try to find it out, but at times you might not be able to, but at least have some awareness. Okay, this might have caused this problem. So let me try to change it. Maybe my sleep was not well yesterday, that is why I'm getting headache. So let me try to get some good sleep today, right? When you change this language of saying something to yourselves, things will change magically for you, right? But the problem is, to find the symptoms, we might not be able to figure out each of the symptoms, right? And that is where we have created a very detailed questionnaire, which is known as profiling, wellness profiling. And I have been helping a lot of people with this profiling because it has more than 65 questions which you can easily identify and which you can mark. And depending on your questions, right, it will generate a score for you. So it has questions related to energy, joint pain, period cycles, hormones, right, brain health, cognitive function, that what we say, stomach health. So many questions are there. And that's when we realize, okay, I was getting this, but probably I was not thinking about it, right? So profiling is important, especially for people who are there in this call. I'll share more about profiling with you personally as we start the 3 day program, maybe on second day. If you are interested to fill it up for you, definitely you can go ahead and do it, and I can share the analysis with you. We have to be aware of the intensity of the symptoms too. If you are having, let's say, knee pain, but that is worse this year as compared to last year, we should take some action, right? So we have to be very, very mindful. The whole idea of working on health is more about mindfulness and awareness, right? Quality of life, again, you have to be aware of your quality of life. If you feel that at the age of 40, maybe I'm facing some of the problems, that it will definitely lead to a degraded quality of life, right? I feel my quality of life is good, and that is the whole core of working on health. So basically, we work on preventive healthcare. We are not saying that if you work on your health, then you will be able to maybe lead up to 100 years. No, that's not the goal. The goal is that whatever years you have in your hand, try to have a healthy aging, right? And that is what we say quality of life. You should not be dependent. You should not be in a fear that, okay, I'm probably hitting 50s and what should happen to my health, right? So it is very, very important to focus on the quality of life. Okay, everyone, have a nice weekend for people who are in US, and let's meet again. Thank you so much.